Welcome to the committee.
Thank you, Mr. Chair. Members of the committee, my name is Twila Brase. I'm from Citizens Council on Healthcare. And we agree that today's healthcare system has some serious problems. However, we do not believe it is for lack of centralization or socializing the medical profession. Our mission is to support patient and doctor freedom, medical innovation, and the right to a confidential patient-doctor relationship. And to those ends, let me address the problems we see for patients if this bill were made law. First, related to patient and doctor freedom, Health File 135 would limit patient access to care and infringe on the physician's ability to make medical decisions that are in the best interests of patients. On page 2, line 8, note that only medically necessary healthcare services will be available to Minnesota patients. Medical necessity will be defined by the 15-member Minnesota Health Board. 15 people without ethical or professional obligations to the more than 5 million patients being affected by the decision. Furthermore, line 11 on page 7 makes it clear that the board will have the authority to deny access to any healthcare services according to the board's definition of, quote, no medical benefit, end quote. Thus, despite vast differences between patients, these treatment decisions will likely be standardized, one-size-fits-all decisions based not on the needs of the more than 5 million very individual patients, but based instead on the preferences, values, judgments, and agendas of the 15 appointed board members. In a sign of things to come, the bill establishes a new ombudsman's office and a statewide grievance system to deal with the resulting unhappy patients. Access could also be limited by physicians refusing to join the system for ethical and/or financial reasons, as is happening today in Minnesota Care and Medicare. Perhaps that is why on page 7, line 25, the bill says that every patient shall have a primary care provider, but it doesn't guarantee that the person that they get is a physician. Second, we believe the proposed socialized medicine system would discourage medical innovation and the medical technologies and treatments that save lives, enhance quality of life, and keep people independent and out of the hospital. Once the proposed Minnesota Health Board is established, treatment decisions and payment authority will be centralized, potentially thwarting the innovation needed for the development of less invasive, more effective, patient-friendly alternatives to today's care. Therefore, patients may not only be limited to treatments of today, but also the treatments of tomorrow. Finally, related to confidential patient-doctor relationship, on page 18, line 2, the bill would authorize state agencies to collect and share private patient data. And on page 3, line 14, to share it with the proposed Minnesota Health Board. The identification card and number proposed on page 4, line 24, will essentially enable patient tracking. On page 19, it would authorize the proposed Office of Health Quality and Planning to get into the medical records of patients for a variety of purposes. On page 22, it would authorize the proposed Inspector General of the Minnesota Health Plan to inspect medical records looking for fraud, abuse, over and under treatment, and other so-called inappropriate utilization of medical products and services. And they would get to define what inappropriate was. Finally, there are several other very troublesome aspects, such as forcing all patients to have a care coordinator, page 7, line 25, the state's taking of contractually mandated retiree benefit payments, page 5, line 7, centralized capitation payments for hospitals and other institutional providers, page 13, line 11, the imposition of what could be called a ban on free speech related to pharmaceutical companies, page 7, line 23, thus making sure patients don't even hear about new drugs, and the proposed ban on private payment by patients, page 10, line 32. Patients won't even be allowed to pay privately for services denied by the board, and this would be an alarming infringement on their constitutional and patient rights.
And about 1 minute more, if we could.
I have even less than that.
I bet you do. Sorry, thank you.
That said, one of the best proposals in the bill is actually the repeal of the healthcare provider tax, page 23, line 11, which is essentially a tax on patients, which is well over $1 billion now. While we appreciate Representative Bly's concern for the issue of health care, we ask the committee to carefully consider whether this bill will actually provide care for patients in need or only promise coverage while limiting access to care. Thank you, Mr. Chair.